Did you know that there are actually different flavors of pain? And it's actually a really useful indication to let you know, what's actually going on in your body. So let me explain just a little bit about what can happen in the body. In brief, is if you've ever had an injury, there's not always blood, broken bones, and you can be told that, quote, everything's fine, but you feel it, something's just not quite right. Well, typically when this initially happens, what your body's gonna do, because your body's not stupid, it's gonna try to use your muscles to try to compensate for whatever that issue is. And so what do muscles feel like if they're under stress, strain? Well, just go to the gym and do an exercise you haven't done in a long time. You're gonna feel sore, you're gonna feel achy, you're gonna feel it shift from here to there to a variety of different places. That's typically what muscles are gonna feel like. Now the kicker is if you have that underlying issue, whatever it is, but you say, oh, it's just because I'm getting older, or oh, I can put up with it, or oh, I can carry on, so forth and so forth, that you leave it alone long enough, well, the muscle won't be able to compensate anymore. Then what it's going to do is it's going to shift into the next kind of tissue in your body, which is called ligament. And ligaments are the things that are designed to hold things tightly together. So what does it feel like when you've got stress and strain on a ligament? It's going to feel sharp, it's going to feel pulling, it's going to be very uncomfortable. And the most common areas where people feel this, they feel it at the base of their neck, lower down right here. They're going to feel it through the base of their lower back, and ultimately it can cause people to have a lot of really debilitating conditions, including disc injuries, torn issues in their sacroiliac ligaments. It can actually cause a person to experience headaches or migraines. Reason for that is because we're not talking about damage to the nerves directly. We're talking about stress and irritation to the connective tissue that surrounds the nerves and the brain. So this is what happens when you've got an issue in the ligament. Now, take it to the next level. Because the ligament is the stopgap trying to hold things together, but when the ligament can't hold it together anymore, then what's going to happen? Then it's going to go into that most important final type of tissue in the body, the thing that everything else is going to try to protect your nerve system, your brain, spinal cord, and the nerves. This is where you do not want things going on because it's not always associated with pain. But if you have something affecting the nerve, it's going to affect the function of your body. So what are some of the common telltale symptoms that you could be experiencing the nerve problem because of the progressive fault and collapse of the rest of the system? Well, it can be that you are experiencing shooting pain, and that can be down into your foot, such as sciatica. It can be shooting pain into your hands, like a carpal tunnel syndrome. It can be that you're experiencing shooting pain in your head, or really any spot in your body. You see, nerves and ligaments are similar because both of them are going to be sharp. The difference is that typically if you have nerve pain, it's going to shoot. Ligament's going to feel like it's stuck in just the one spot. But pain is not the only thing that can go wrong in the body when you affect the nerve system. It can affect your sense of balance. It can affect the way that your muscles are able to coordinate, so they can get twitchy or tight, chronic-y, weird things like that. It can affect the clarity of your thoughts. It can affect any function that you can conceive in your body. And oftentimes it's the result where it's not simply a matter of aging, but old issues where the body initially tried to compensate it with your muscles. Muscles couldn't take it no more. It went to your ligaments. Ligaments couldn't take it no more. Now you're dealing with the nerve issue. And so you can use your particular kind of symptoms to figure out, which category do you fall into? Because that lets you know, okay, what is the true nature of my condition? And then when you're working with your doctor, with your allied health practitioner, we have to let you know, okay, hey, here's the nature of what you have going on. Sorry, this is not going to be fixed for your grand final match on Monday. This is going to take a little bit of work to get you all the way there. So I hope that this video has offered you a little bit of additional insight as far as a few things about, number one, how the body works, but number two, if you've been experiencing different kinds of issues in your own body, so that you might have a better understanding about, well, where in this continuum are you most likely? And of course, if you do have any questions or would like somebody to chat to, to find out, okay, what's going on and might there be a solution for you, we'd like to hear from you. My name is Dr. Jeffrey Hanna, and I am the Director and Principal at Atlas Health Australia, which is the premier upper cervical health center in Brisbane.